What if your body was trying to warn you, but you brushed it off as stress, hormones, or just being tired? So many women are taught to push through pain, to keep going, to minimize symptoms. But some signs are not normal, and ignoring them can turn small problems into life-changing emergencies. Today, we're talking about 3 symptoms women should never ignore. These are red flag signals your body uses when something deeper is going on. This video could protect your health, or even your life. So stay with me. If you care about your hormones, your energy, your long-term health, and understanding your body better, you're in the right place. Let's get into it. Symptom #1. Unusual or persistent pelvic pain. Let's start with something many women experience, but often dismiss. Pelvic pain. A little cramping during your period? That can be normal. But ongoing, severe, or unusual pelvic pain is not something to ignore. What concerning pelvic pain feels like? Pain that lasts beyond your period sharp, or stabbing sensations pain during intimacy pain that radiates to your lower back, or legs a deep pressure or heaviness in your lower abdomen pain that interferes with daily life. Why women ignore it? Many women are told, period pain is normal, you're just stressed. Take a painkiller and rest. So they do. They take the pill, rest for a day, and move on. But here's the problem. When pain is silenced without finding the cause doesn't disappear. It grows, spreads, and becomes harder to treat. And years pass. That's why many women reach their 30s or 40s with a diagnosis that could have been caught in their 20s if someone had listened sooner. Severe or ongoing pelvic pain can signal conditions like endometriosis, tissue similar to the uterine lining growing outside the uterus, ovarian cysts, fluid-filled sacs that can rupture, uterine fibroids, non-cancerous growths causing pain and heavy bleeding, pelvic inflammatory disease, an infection that can damage reproductive organs, ectopic pregnancy, a life-threatening pregnancy outside the uterus, ovarian cancer, one of the most silent cancers in women. Some of these conditions can progress quietly for years before diagnosis. Let's talk about endometriosis for a second. It affects roughly 1 in 10 women worldwide. Yet the average time to diagnosis is 7 to 10 years. 7 to 10 years of pain. 7 to 10 years of being told it's normal. 7 to 10 years of suffering that could have been addressed. That number needs to change. And it starts with women refusing to accept dismissal as an answer. The danger of waiting. When pelvic conditions go untreated, fertility can be affected, chronic inflammation can worsen, pain can become debilitating, emergency surgery risk increases, and in rare cases, delays can become life-threatening. What to do instead? If pelvic pain feels different than your normal cramps, gets worse over time, happens outside your cycle, affects your quality of life, schedule a medical visit. Track your symptoms, date, intensity, what makes it better or worse. Ask for imaging if pain continues. An ultrasound or memory can reveal a lot. Don't accept it's probably nothing. Push for answers. You deserve to know what's happening in your own body. Symptom #2. Extreme fatigue that doesn't improve with rest. We live in a hustle culture that glorifies exhaustion. Being tired has become a badge of honor, like if you're not running on empty, you're not working hard enough. So when women feel constantly tired, they blame work, family responsibilities, hormones, poor sleep, and they keep pushing. But extreme fatigue that doesn't improve with rest is a serious warning sign. This is not, I stayed up late, I had a long week, I need a nap. This is waking up exhausted even after a full night of sleep. Brain fog that makes it hard to focus. A heavy feeling in your body. Struggling with tasks that used to be easy, needing multiple coffees just to function. Feeling like your battery never fully recharges. What this could signal. Persistent fatigue can be linked to iron deficiency anemia. Thyroid disorders, both underactive and overactive thyroid, affect energy. Autoimmune diseases like lupus or multiple sclerosis. Hormonal imbalances, low estrogen, progesterone, or testosterone. chronic infections like Epstein-Barr virus, depression and anxiety, which have real physical symptoms. Heart conditions? Yes, fatigue can be cardiac. Diabetes, uncontrolled blood sugar drains your energy. Women are especially prone to iron deficiency due to menstruation. Every month, blood is lost. With it, iron is lost. And iron is what carries oxygen through your blood to every cell in your body. Low iron circs low oxygen. Low oxygen circs low energy. It's that simple. And yet so many women are walking around with iron levels that are technically within range, but far too low to feel good. There's a difference between surviving and thriving. Why women overlook it? Because tiredness feels normal. We are expected to do everything. Work full-time, raise children, maintain relationships, keep the house, manage emotions, show up for everyone, and then smile while doing it. So when exhaustion hits, we assume it's just the cost of being a woman. But your body was not designed to run on empty indefinitely. Constant fatigue is your body saying, I don't have the resources to function. When to take it seriously? If fatigue lasts more than 2 weeks, interferes with work, relationships, or daily tasks, comes with dizziness or shortness of breath, causes hair thinning or hair loss, makes you feel weak or faint, gets worse instead of better with rest, it's time for blood work. And a medical evaluation. What to do? Ask your provider to test iron and ferritin levels, thyroid hormones, T3, T4, vitamin D. Deficiency is extremely common and very draining. B12, especially important for vegetarians and vegans. A full hormone panel, estrogen, progesterone, cortisol, blood sugar, and A1C. Don't let anyone tell you that being tired is just part of life. Fatigue is not laziness. It's not weakness. It's often biology, and it's treatable once you find the root cause. Symptom #3. Sudden changes in your period. Your menstrual cycle is one of the most powerful health indicators your body gives you. Think of it as a monthly health report. When everything is working properly, your period shows up on schedule, lasts a predictable number of days, and feels manageable. When something is off internally, your period reflects that. It changes, it shifts, it sends a signal. Concerning changes include bleeding much heavier than usual periods, lasting longer than 7 days, bleeding between periods, spotting that has no clear cause, severe clotting, especially clots larger than a quarter cycles, becoming very irregular when they weren't before your period, disappearing completely, and you're not pregnant, severe new cramps that are different from what you normally experience, sudden changes in PM symptoms, extreme mood swings, bloating, or breast pain. Why this matters? Your cycle reflects hormonal balance, uterine health, thyroid function, stress response, metabolic health, nutritional status. It is connected to almost every system in your body. When your period suddenly changes, something in one of those systems has shifted, and your body is trying to tell you. Sudden changes may signal polycystic ovary syndrome. PCOS affects hormones, ovulation, and cycles. Thyroid disease, both hypo and hyperthyroidism, disrupt the menstrual cycle. Uterine fibroids or polyps, growths that cause abnormal bleeding. Endometrial issues, including hyperplasia, which needs attention. Hormonal imbalances, estrogen dominance or low progesterone. Perimenopause, which can begin in the late 30s. Pregnancy complications, including early miscarriage. Stress-induced hormonal shifts. Chronic stress raises cortisol and suppresses reproductive hormones. Significant weight changes, rapid loss or gain affects estrogen levels. Heavy bleeding, a special warning. If you are soaking through a pad or tampon every hour for several hours, passing clots that are large and frequent, feeling dizzy, lightheaded, or faint during your period. Feeling your heart racing during your cycle. That is not just a heavy month. That is blood loss at a level that can cause severe anemia. Anemia from heavy bleeding can lead to extreme weakness, heart palpitations, shortness of breath, fainting, and in serious cases, hospitalization. You should not be white-knuckling your way through your period every single month. When to get checked? If your period changes noticeably for 2 to 3 cycles in a row, talk to a healthcare provider. Don't wait 6 months hoping it goes back to normal on its own. Track your cycle monthly. There are free apps that make this easy. Note: how many days it lasts, how heavy the flow is, any spotting in between pain levels from 1 to 10, any other symptoms during that week. This data is incredibly powerful when you sit down with a doctor. It turns "my period has been weird" into "here is exactly what has been happening and when." Doctors can work with data. Data gets answers. Your period is a monthly health report. Don't ignore the data. Why women dismiss symptoms. Women are often taught to endure pain, care for everyone else first, minimize discomfort, avoid being dramatic. From a young age, many of us heard, "That's just part of being a woman. It's not that bad. Everyone feels like that." And so we internalized it. We stopped trusting our instincts. We started second-guessing our pain. We felt guilty for needing medical attention. But here's the truth. Listening to your body is not dramatic. It is intelligent. Your body is always communicating with you. Pain is communication. Fatigue is communication. Cycle changes are communication. The question is, are you listening? What happens when women advocate for themselves? Conditions get caught earlier. Treatments are more effective. Fertility is preserved. Quality of life improves. Lives are saved. This is not an exaggeration. Early detection of conditions like ovarian cancer, endometriosis, thyroid disease, and anemia changes outcomes dramatically. Not just survival rates, but quality of life, fertility outcomes, and long-term health. Prevention saves time, money, fertility, long-term health, and sometimes your life. The mindset shift you need. Stop thinking of doctors' visits as overreacting. Start thinking of them as maintenance. You take your car in for a checkup. You service your appliances. You maintain the things that matter to you. Your body, the only one you will ever have, deserves at least the same level of care. What you can start doing today: start tracking your cycle. Even just on a calendar, write down symptoms when they happen. Don't rely on memory. Schedule an annual checkup if you haven't had one. Ask specific questions at your next appointment. Don't wait to be asked. Get your blood work done. Know your numbers. Find a provider who listens. You are allowed to switch doctors. You are your own best health advocate. Nobody knows your body better than you. And when something feels off, trust that. Ask questions. Seek care. Push for answers. You deserve to feel strong, energized, and well. Your body speaks in symptoms. Pain, fatigue, cycle changes. These are messages, not inconveniences, not overreactions, not weakness, not drama. They are your body asking for help. The earlier you listen, the easier it is to heal. So if something feels off, trust yourself. You know your body. Honor what it's telling you. Because the women who catch things early are the women who get to keep living fully. And that is what you deserve. If this helped you, share it with another woman in your life. A friend, a sister, a mother, a daughter. She might need to hear this today. Subscribe for more women's health content that gives you real information and puts you back in control of your health. And remember, your symptoms are valid. Your pain is real. Your health matters. And you never have to ignore the signs. That's a wrap. See you in the next